Today's video, we're going to be talking about how to prevent lateral epicondylitis or tennis elbow. We'll be going about what the pathology or what the injury actually is and what are some potential things that can cause you to be injured. We're going to do some exercises that people should be doing or can be doing to help load the area to be preventative for it, and why you should be seeing your physiotherapist if you do get tennis elbow. We'll be also talking about a few different ways that could also lead to tennis elbow from different areas of the body. Simply, we're just going to begin with the anatomy. So tennis elbow affects the outside of our elbow. So the lateral epicondyle, it's basically an injury of the tendon. So you have your muscle belly and the muscle is attached to the bones via tendons. That's where the injury is. It's the injury of the tendon where it kind of attaches near the bone. Think of it as like a cable and there's like little fraying at a cellular level happening there. Now, there's a lot of important muscles of the back of the forearm that are at play. These muscles that attach onto that part of the tendon are, you have your extensor carpi radialis longus, our extensor carpi radialis brevis, extensor digitorum, and our extensor carpi ulnaris. Those are our outer layer. And then beneath that, you have even more deeper muscles that attach in and around that area as well. But the top four make up the main common tendon that attaches on the lateral epicondyle. So when those muscles get used and they're gripping and extending, that's what causes pulling on that elbow. Why we get injured? So I like to think of this injury as an overloaded, underprepared injury. Basically what that means is that the muscle had to be required to do a lot of work that they weren't prepared for, and that causes strain at the tendon. So in a personal example, when I was starting to increase my weightlifting routine a few years ago, I increased my gym sessions from 3 to 4. I also started mountain biking and golfing in the same week. So my muscles weren't used to all of that volume, so I had a lot of extra gripping from golfing, from mountain biking, and then lifting weights an extra day. And that kind of started to flare up my lateral epicondylitis or my tennis elbow. I know golfing led to it, but we'll get into that anyways. Basically, from them being underprepared and overloaded, the muscles were pulling hard and getting really tight and causes strain at the tendon. So that's kind of like what could lead to these injuries. So we want to make sure that they're prepared. Some other causes that can kind of lead to these injuries is neck-related conditions where the nerve is impacted that feeds the muscle. So if you have neck impingement, like a cervical radiculopathy, of any of the nerve roots that impact the muscles at the elbow, that could also be an underlying reason why you would get tennis elbow, or if it's kind of having some shoulder problems. So if you have a poor ability to rotate your arm out to the side, your body may cheat and try and use your forearm for assistance. And if you do that repeatedly over time, that's just another way of you using your elbow a lot more, and that can kind of cause it to be overloaded. To prevent tennis elbow, we need to think about keeping the muscles long and strong and preparing for new activities. This is going to be exceptionally difficult in people that work like heavy labor jobs, and they are doing a lot of repetitive movements, and it's hard to fit in additional exercise and activities. But we want to kind of plan ahead. So if you're someone who wants to, say, pick up mountain biking, for example, which is going to involve a lot of gripping, we want to be preparing the muscles for it. Now, the reason why we get tennis elbow from gripping is that our big forearm muscles on the front that kind of pull our fingers together, the back muscles where you get it, they help form the shape. So if you didn't have those muscles in the back, your hand would just close without any actual counterforce. So those back muscles here are important to kind of give counterforce to actually help with the shape. You can see this really in patients with or clients with spinal cord injuries where their muscles no longer work in the back of the arm, but they still have the front, and their hands will just close and they have nothing to help open it. So it's the working of the front and the back that work together to help shape. So that's why those muscles will get used a lot, because we're often stronger in our squeezing and gripping, and then those ones in the back aren't used to being that counterforce. The first thing we need to do is strengthen and lengthen. That's how we're going to prevent the tendinopathy from occurring at the elbow there, by making the muscles strong enough to perform for what we need them to do. The best exercise to do that is an eccentric wrist extension. So slowly lowering the hand down. You want to kind of start with a lighter weight. So basically what you're doing is you're bringing the weight up, and it's a 1, 2, 3, 4 count down. This is lengthening of all the wrist extensor muscles, so the muscles in the back here. Bringing it up, and a 1, 2, 3, 4 count down. It's all about that 1, 2, 3, 4 count down for this exercise. That eccentric load where the muscle is lengthening, that really helps to gradually load the tendon. And that's what makes the tendon thicker and more durable and the muscle stronger. So you want to be doing this exercise at least 2 to 3 times per week. You also want to be doing 2 to 3 sets and working up from 8 to 15 repetitions. These muscles aren't going to lift hundreds of pounds on their own, but they need to have really good endurance for when you're doing the repetitive gripping. So starting with a lighter weight, working yourself up to about 15 reps and adding in a third set when you can, doing 2 to 3 sets session is going to be key. So always emphasizing that 4 count down. Another really important exercise is forearm rotations. So pronation down, supination palm up. Using a hammer is an excellent way to do this exercise because the weight is off kiltered. Holding it elbow at your side, you're just going to rotate the hammer in both directions. This just helps to work all the muscles again that attach in the forearm. Another repetitive way that is easily caused by injury. Same kind of deal is you want to try and do 2 to 3 sets of working up from 8 to 15 reps. To make it easier, you can choke up on the hammer a little bit because then there's less counterweight, or have something with a longer lever, or use a heavier hammer. Again, you want to be kind of slow and controlled, trying to think about it. You're taking several seconds to go through the full rotation. If that's too easy, having it at your side, you can have your elbow extended and then rotating it on a longer lever. This does make the exercise more challenging. As your elbow is extended, the muscles are a little bit longer and the weight becomes a little bit harder through here. Similarly, 2 to 3 times per week to really get those initial gains, trying to work from 2 to 3 sets of 8 to 15 repetitions. Lastly, after doing activities, it's really important to stretch the forearms to help decrease the tension, mostly just meaning to just increase the length. The best way to do it is hands over the fingers, elbows at your side, and you're just pulling the fingers back. If you pull the wrist, sometimes people just feel pinching at the wrist and they don't get an actual stretch because their fingers are still extended. So if you actually pull the fingers down, you actually get the tendon length a little bit better. Keeping it at your elbow bent 90 degrees is a good beginner way. As you get more comfortable with that, you want to do it with your arms straight, pulling the fingers back, and you can really feel that stretch all through the muscles there. You want to do that for about 60 to 90 seconds to start, and working up to 2 minutes actually. And that'll be a good way to keep the length there. Now, if you are having pain in that area and you do suspect you might actually have tennis elbow, it is really important to have your physiotherapist see, because it could be something from your neck, your shoulder, or it could be some activity you need to modify, and they can help give you the proper exercises that you need to be individualized and help give you strategies like counterforce braces or different things that you should be trying to do to make your condition better. The exercises we went through are really beneficial to help load the tendons and make them stronger, to prevent tendinopathy, and yes, some of them would be used in the treatment as well. The take-home message is that there's lots of little muscles in the back of the forearm that help structure the shape when we're grasping. This is a condition of overloaded, underprepared, so we want to make sure the muscles are long and strong. These exercises are effective beginner ways, and really we just want to be gradually loading things. So if you're starting a new activity, you want to be planning ahead to start with a shorter period of time with 1 or 2 sessions a week and gradually building it up. Not doing what I did with adding 3 new activities in the same week. That's a surefire way to have something go wrong. Thanks for watching. Please like and subscribe, and leave a comment below of something that you'd be interested to see next. Tune in next time.